How's it going, guys? Past level question, Neuro Ophthal steps 1 and 2. We have a 30-year-old woman brought to emergency, gradual diminishing vision in her left eye since awakening 6 hours ago. Her symptoms began with a mild headache over the left eye before going to sleep last night. Fundoscopic examination shows no abnormalities. However, she cannot read text, cannot count fingers with her left eye. Visual acuity normal in the right eye. What's most likely diagnosis? Choice A, cluster headache. Wrong fucking answer. It's usually a male, 20s to 40s, who's going to have an 11 out of 10 lancinating/stabbing headache behind one of the eyes, usually awakening him up from sleep in the middle of the night. And then they're going to say he paces around his room up to a half an hour and then it goes away. There can sometimes be lacrimation, pupillary changes, even rarely rhinorrhea, but it's going to be that the dude is woken up from sleep. They pretty much every vignette, it's very buzzy that way. In contrast, trigeminal neuralgia, which of course I didn't mention here, is going to be an 11 out of 10 stabbing pain in the face. If it's the ophthalmic distribution of the trigeminal nerve, it can appear like cluster headache because it occurs behind the eye, but rather than being a dude who's woken up from sleep, it's going to be a gust of wind, brushing hair, brushing teeth, those types of minor stimuli that induce the pain. Okay, but cluster headache, verapamil is the prophylaxis, and oxygen is the treatment. Wrong fucking answer. Choice B, embolus, wrong fucking answer. So if we were to hypothesize that she's got carotid stenosis due to atherosclerosis, launches off to the eye, you get amaurosis fugax, acute painless loss of vision. So central retinal artery occlusion. She's not in that demographic. 30-year-old woman with atherosclerotic carotid disease, very unlikely. You could be thinking of atrial fibrillation if you have a left atrial mural thrombus that's launched off to the eye, also not demographic. She's not over the age of 70. Wrong fucking answer. Choice C, optic glioma, wrong fucking answer. Very high yield, shows up in the NME, that this can occur in neurofibromatosis type 1. Chromosome 17, autosomal dominant. Neurofibromas, there'll be nodules under the skin, cafe au lait spots, hyperpigmented macules. Axillary groin freckling, you get pheochromocytoma, you get weird brain cancers like oligodendroglioma, ependymoma, but optic glioma, they want you to know, occurs in NF1. In this case, wrong fucking answer. Choice D, optic neuritis, correct answer. So this is on USMLE essentially pathognomonic for multiple sclerosis with women 20s to 30s, classic demographic. This just means inflammation of the optic nerve, cranial nerve 2. And it can present with multifarious findings. It can just be reduced visual acuity in an eye. They can say that there's altered color vision in an eye. They can say central scotoma. They can give you, which is a blind spot, they can give you a Marcus Gunn pupil. Okay, that's the relative afferent pupillary defect where you swing the light between the eyes. Okay, so you just got to know this is very, very buzzy for multiple sclerosis on USMLE. Okay, so the two eye findings you get with MS and USMLE, number one, optic neuritis, which is this. Just, you say, I don't know what's going on. There's something with one of the eyes. Yes, in a woman 20 to 30, so that's MS, okay, optic neuritis. The other is MLF syndrome, medial longitudinal fascicular syndrome, internuclear ophthalmoplegia. That's where you look to one side and the side that's fucked up can't adduct. Okay, I talk about all that stuff in my neuroanatomy PDF. I have charts on this. I'll link my neuro and my neuroanatomy PDF below. You can read all about this stuff. But this is optic neuritis and MS, and USMLE wants intravenous corticosteroids for this. They're not going to force you to choose between oral and intravenous, but it's intravenous, okay? Methylprednisolone. So let's just hop to the final answer, temporal arteritis, wrong fuck answer. She's too young. Okay, it's not to say it's impossible in real life, but it's going to be over the age of 50 on USMLE. So they'll just give you temporal headache with potential visual changes. Okay, so ischemic ophthalmopathy is how the NBME can write it. You obviously have to give steroids before biopsy to prevent blindness. It can be associated with systemic findings, i.e. polymyalgia rheumatica. So if they mention pain and stiffness systemically of proximal muscles, that's PMR in conjunction with temporal arteritis. You can get jaw claudication. Temporal arteritis, wrong fucking answer. You know the deal. I'm to make more content on my subscription. Appreciate your time. That's it.